press conference.
22 months since the first case of COVID-19 were reported, and almost a year since the first vaccines were approved, reported cases and deaths from COVID-19 are increasing again. More than 5 million deaths have now been reported, and we know the real number is higher. We're still losing more than 50,000 of our sisters and brothers every week. Last week, 56 countries from all regions reported an increase in deaths from COVID-19 of more than 10%.
And reviews. We also have the legal.
Yesterday, we added another new tool with the emergency use listing of Covaxin, the AIDS vaccine to receive WHO validation for safety, efficacy, and quality. Emergency use listing contributes to vaccine equity by enabling countries to expedite their own regulatory approval to import and roll out vaccines.
This press briefing has simultaneous interpretation.
We continue to hear excuses about why low-income countries have only received 0.4% of the world's vaccines. One is that low-income countries can't absorb vaccines. That's not true. With the exception of a few fragile, conflict-affected, and vulnerable countries, most low-income countries are ready to go. The problem is simply that they cannot get the vaccines.
Thanks for taking my question.
So even where we're not seeing the same increases in hospitalizations as we saw earlier in the year, a smaller number of cases is placing an even greater burden on the system because the systems are tired. The people in the system are tired. They're still fighting very hard, but it's very hard for them to be able to react in the same way. It is very difficult to sustain the kind of effort that's needed on everyone's part, on the part of health workers, on the part of communities, on the part of government. There's exhaustion, and exhaustion is leading to complacency, and complacency is leading to gaps in our system, gaps in testing, gaps in clinical management, gaps in vaccination. And it is through those gaps that we see transmission. It is through those gaps that we see the hospitalizations and the deaths. And we need to close the gaps.
Same week, we have the G20 in Rome. We have the climate.
We only have to look at the roller coaster epidemiologic curve to know that when you're coming down the mountain, you're usually about to go back up another one. And the fact that Europe is climbing that mountain again should really stand everybody up around the world and say, what are we going to do? Because Europe does have the capacity, and European countries have the capacity. They have the vaccine access. They have the money. They have the systems in place that they can react. Many other regions don't necessarily have those capacities in place. So I think it's a warning shot for the world to see what's happening in Europe despite the availability of vaccination.
That leaves it vulnerable to politics.
So when we call for greater funding for WHO, more support, more accountability, and more authority, this is not a favor that we are doing to WHO. It is, because we care about global health, and we care about the support that is required and that needs to be given to countries. We believe that a much stronger funded WHO with greater authority out of the geopolitical positioning is the way to go. And that can also make the organization more accountable, and then we can all be more demanding vis-a-vis the organization.
Let's go to John Zaracostas from The Lancet.